Oh, I like that. So good morning to everyone. By a show of hands, how many folks are enrolled in the 70-30 plan? By the way, she introduced me. I'm Monique Merriweather-Yarborough over on Central Campus in the benefits office. And so what we're going to do is just give you a little bit of information about the things that are new for benefits this year, what you must do in order to get the lowest premium possible. Because some of you may know of some folks that have incurred a surcharge for the plan year, which wasn't fun, I'm sure. By show of hands, how many people are in the 70-30, if you don't mind me asking?
I think I am. I don't know.
Keep your hands up. 80-20, and the CDHP, which is the Consumer Directed Health Plan. So everybody had their hands up, almost, I believe. That means that everybody must do something in order to maintain the lowest premium possible for the plan year. Normally on the 70-30 plan, you didn't have to do anything. You just enrolled in the plan. You didn't have to complete any of the wellness credits, but this year.
And then I'm 80-20. I'm sorry.
This year you do.
Okay.
For the 70-30 plan, you have to complete one of the wellness credits, which is the smoking attestation, in order to maintain the lowest coverage. If not, you will pay a $40 surcharge for that smoker attestation for the remainder of the plan year. So that's 40 times 12, which is about $500. All I can say is ouch. If you fail to complete your wellness credits, I suggest you put a stack of money on your card, ride down Western Boulevard, and that's what you're doing, you're throwing money away, okay? Let's go ahead and get started with the presentation. Annual enrollment is October 1st through the 31st, so we've already started. We're well into annual enrollment. These changes are effective for January 1st, 2017. Okay. So, I want to have you enroll for your state health plan, which is either 70-30, 80-20, or the CDHP plan, and the NC Flex plans are to go into MyPac portal, go into for faculty and staff, and then click on enroll in benefits. Now, in the instance that you have a problem completing your benefits, enrolling in benefits, this is the number that you would call, 855-859-0966. They will complete your enrollment on the phone. If you have to call, be sure to get the representative's name, the time that you call, and the date that your benefits were completed. If you don't have to call, if you complete them online, please print out your confirmation. If you feel more comfortable taking a picture of it with your phone, do that, but please print your confirmation statement. Needless to say, but I will say it, compare your confirmation statement with your paycheck. You want to make sure that the benefits that you signed up for are the benefits that are being deducted from your check on a monthly basis. Okay, I've had employees call and say, I'm at the dentist's office and my child doesn't have dental coverage. They failed to enroll the child into their dental benefits, or thought they had enrolled the child that they had. So by all means, make sure you compare. So again, this is how you would enroll in your benefits for here. If you look at the icon to the right of enroll in benefits, you'll see the benefit icon. That's where you can print out your confirmation statement, or right from the page once you completed it. At the top, it'll say review and print your benefits. It's written in blue, and then there's like a 16-digit number there beside your name or underneath your name that tells you that you've completed your enrollment. I'm not just having a hard time with this. I know I can roll it, but can I not just click it either?
You should be able to. Let's just use your noise.
Is mine not going to come? I'll just do it. I'll just have to enroll it because it doesn't, it seems like it doesn't work with me.
There it is.
That's mine. Okay, that's screen.
So if I click on that, that's doing it, right? No, no, no.
Yeah.
Yeah, yeah. Concept is like- It's going to be that. But it must get cold.
Like I said before, all employees will need to take action during the annual enrollment period and elect their desired plan or lower their monthly premiums. So again, for the 70-30, the 80-20, and the CDHP plan, you'll need to complete a task or wellness task in order to maintain your lowest premium. And what does this mean? What does this mean for me? All members will default, or if you try to enroll, you'll see that you've been defaulted to the 70-30 plan. Regardless of what plan you're currently enrolled in, everyone has been defaulted to the 70-30 plan. Hence why you'll have to do something if you want to take advantage of having a lower premium for either plan. All enrollments must be completed by October 31st. Okay. Any changes that you're going to complete, they must be completed by October 31st. So in regards to the 70-30 plan and the 80-20 plan, there are changes to the annual deductible. There are also changes to the out-of-pocket maximum and various copays. Beginning January 1st, 2017, CVS Caremark will be the pharmacy benefit manager, which is currently Express Scripts. Under all three plans, the formulary for prescription drugs is moving from an open to a closed formulary. Now, what that means is that your prescriptions that you are currently on now, you need to go online to the state health plan and determine whether or not your prescriptions are covered. By us moving from an open to a closed formulary, that means that prescription medication that's not on this list are going to be your responsibility at 100%. Okay, so that's very important for folks that are on medication. If we need to start or submit an exception to the plan, we'll need to start that as of January 1st, 2017. But you need to go and print out the list, take it to your provider to see if there are any medications that are on the list that could be used in place of your prescriptions that you have now. And I say do this because, as you can imagine, by this affecting all state employees, everyone's going to be submitting an exception, or their provider will be submitting an exception so that they can stay on the prescriptions that they're on. If there is a certain quantity, say if you're taking 30 milligrams, but the plan only dictates that you're able to take 20, then there will need to be an exception provided or submitted on your behalf as well. Okay, so let's be proactive about this, taking advantage of this time between January 1st, 2017, providing that list to your primary care provider. So going forward, the following prescription or pharmacy programs will be discontinued effective January 1st, 2017. Member Pay the Difference program, that's no longer, the member will be responsible for the entire prescription if it's not listed on the drug list. Low cost generic cholesterol lowering medication, that program will also be discontinued as well. Again, as of January 1st, 2017, the state health plan will be transitioning to a new pharmacy benefit manager, which is CVS Caremark. And you can go to caremark.com now and register on this, on their site as well. Members impacted will receive communication regarding what steps to take next. But you need to make sure that you take advantage of this time again, because the cards that you have now, they will not work for pharmaceutical come January 1st, 2017. Everyone will receive a new benefits card, as well as any dependents that are on your plan. Like I said, members will have access to the CVS Caremark online drug lookup tool during open enrollment. So go look up your drugs, okay?
This would be just something for recurring,
Medication,
right? I take this pill every day.
yes.
Okay.
So if you get in a 30,
Not if
60,
I'm sick, I got strep throat, I gotta go get some sort of thing. That's not this.
well, if you have strep throat and they're gonna prescribe a Z-Pack to you, I'm just grabbing that
Sure.
out of the air, that may be the case, to see if that prescription, and that's why I say, you're gonna go get that list, provide it to your care provider in the instance that you do have that.
Okay. So I just have to make my doctor pick something off this list.
Right,
Check.
exactly. So they may wanna have that as a part of your jacket going forward, so that any prescription medications that's prescribed to you, they have that information on hand. That's a great question, thank you. The tools that are available will let you look at how much you're gonna have to pay for this on the 70-30, the 80-20, or the CDHP plan for your prescription medications. So we've already gone over this, the open formulary versus the closed formulary, and what it means and how it's going to impact you as a member and your medication. These are just the different tiers as they're applicable to the different plans that you're on. In regards to the consumer directed health plan, it's kind of a moot point because we pay for prescription medications out of your HRA anyway. You're gonna pay for medication. So again, I cannot stress this enough for the wellness premium credit amount for 2017. You see, normally in the 70-30 plan, there was not a wellness credit that was applicable to this plan. This year it is. If you fail to complete the smoking attestation and say that I do smoke, I do not smoke, or I do smoke and I plan to enroll in a program, you will be charged the $40. I did have an employee say, hey, I smoke, I'm gonna continue to smoke. So then you could, it's a moot point. You don't even have to complete the 70-30 part of it if you're gonna put down I already smoke, okay? But do take some action if you want to take advantage of having a board room. And just so you know, that amount for the CDHP, the $80 is added on to your normal monthly premium. So if you're paying for family coverage, $699, then it'd be $699 plus that $80 on top of that, okay? Just wanna make sure. And the premium for the 80-20 did go up this year. It's usually $14.20, it went up to $15.04, just to let you know. So this is just an overview of the health plan options with the consumer directed health plan, which is the 8515 plan, with the HRA, which is a health reimbursement account. You're giving money up front, fiduciary funds with this account, depending on your level of coverage, whether it's employee plus one, or employee plus two. They give you money to offset the deductible of this plan. Okay. With this plan, ACA preventive services such as physicals are covered at 100%, as well as preventive medications that are on this list. And there is a list that gives you all the preventive medications that are on there. Wellness premium credit reductions, and then there's additional ways of adding funds to your HRA this year, where you can participate in caloric counting, or either track your exercise, or either speak with a health coach 3 times per year. Anyone that's on the CDHP plan for this year, there's still time to add an additional $50 to your account, because as you know, those funds roll over to the next year. any funds that you haven't used.
That was gonna be my question. Do they continue to roll over year after year?
As long as you participate in the plan.
Okay.
So the question was, do the funds from the HRA, which is a health reimbursement account, do they roll over each year? And they do. Any funds that you haven't utilized in the plan will roll over to the next plan year granted you continue to participate.
Can you explain the HRA?
Sure. The HRA is called a health reimbursement account. And for employee only, they'll give you $600 up front. And it's to offset the deductible that's associated with this plan. It has a rather high deductible, $1,500 for an individual and $4,500 for a family. So if you enrolled in the plan yourself, the $600 would go towards your annual deductible. And in the end, you would come out paying about $2,900 if you, one, reach that first tier of exhausting or reaching your annual deductible and then the maximum out of pocket.
So essentially, instead of having a $1,500 deductible, I have a $900 deductible because you give me $600.
You have, right, and in the end, you would have totally out of pocket would be $2,900. I always, when I teach this for Ben 100, which is the new hire orientation class, I usually say this plan, the CDHP is for someone that's well or someone that's extremely sick. Because if you're extremely sick and you're going to the doctor over and over again, then you're gonna, one, reach your high deductible, your annual deductible, which is $1,500. And then any out-of-pocket expenses will be capped at $3,500.
What if you know that you're gonna, like you're planning like I have an elective surgery and
Exactly.
I know that I'm gonna do it in April.
Right.
Right, I would.
You would, is it you
Yeah.
only? Is it for you, your coverage
No.
only, or you plus family?
Me plus family.
Employee plus 2 or more is $1,800.
Okay.
So right there, one person could use the $1,500 out of the $1,800 to satisfy the annual deductible.
Okay.
And then you're gonna spend an additional funds to reach that 25 because the annual deductible goes towards the maximum out of pocket. And so you could maximize it by also opening a flexible spending account to offset the amount to have a procedure. And I think that's very smart. This is how I always teach that you need to think about what you want to do for the following year so that you can create a flexible spending account, max that out so that it creates less of a hardship financially for you. And then if this plan, because it gives you money up front, and that $1,800 is for the entire family, but one person could exhaust it.
Okay.
Okay. I would also suggest that you find out from your provider, you say it's elective surgery, to see how much it's gonna cost.
Okay.
And then you see if you're gonna reap the rewards of this plan.
Okay.
Okay.
And something, sorry, I was gonna, it's just having that same thing that Monique was saying a while ago about those incentives that you get. That's something that I never really realized until I saw it. Like, you can monitor your HRA online, and whenever you go, like your PCP, you get that
$25, as long as it's not a preventive, because preventive is at 100%. But like I went to, for my bronchitis, there's 25, my office visit was $200. So from my $1,800, I gave my card, no monies were exchanged. I gave my Blue Cross Blue Shield card. They took the $200 from that $1,800, so I had $1,600 to work with. The Z-Pack that he prescribed, I went ahead and used that, my HRA card that they give you to fill my prescription. So any funds that are left over, they roll over to the next year.
So what's the monthly premium on that?
The monthly premium is $0 for employee only. But for me, it's $189 for five people, it's me plus 4. Which I thought, we don't get sick.
Well, yeah, we don't either.
So the
I do annual.
$1,800, and then I get another $1,800 at the beginning of the next plan year to go on top of the 16 that I still have remaining.
So but the HRA and the FSA roll over?
The flexible spending accounts do
Does
not.
the HSA
You have a
does.
grace period until March the 15th.
Lot of room in right
following
center. If we hit one
plan.
there, we can
But
do some
essentially,
research.
it's a use it or lose it plan.
But the HRA does roll over.
The HRA does roll over.
So if all you do is an annual physical,
You're gonna get money just like that. And especially, because you're on it, aren't you? you're gonna go ahead and participate in either tracking your caloric intake or track your exercise. And then you're gonna make a call into your health coach 3 times a year. You could do it Monday, Wednesday, and Friday, and you're gonna get $25 added to your account. Just like that.
So when you say added to your account, to use for prescriptions?
To use
or-
for prescriptions, to use for doctor visits, to offset an annual deductible, all of it goes into that kitty for the HRA.
So if it's me only and I have $600, you're
That's
saying
right.
up front, that's for me to spend, or does it just reduce my deductible? Because normally when I'm thinking I have to pay out of pocket to meet my deductible.
Exactly, but this money is given to you to meet your
Okay.
deductible.
Okay.
So if it was only you and your $1,500 is your annual deductible, the $600 would be given to you to satisfy $600 of that $1,500.
Okay, and that's what I could use for.
You can use it for doctor visits, but keep in mind, this plan does not have a copay with it. So when I went to the doctor, I was on the 80/20, I'd pay $15 and be done. But that visit was $200 because their doctor is gonna code it according to the visit.
Right.
Okay?
And is that for like specialists, if you go to orthopedic or,
The specialists are $60.
but does it still come out of my?
It comes out of your
I need
kidney.
MRI, I still just give my card.
You can give your card. For the doctor. Let me make sure about the MRIs because, yeah, they would. They're gonna be considered a visit and what I did was contacted my primary care provider to say, this is the plan I'm enrolling in, how do you treat this plan?
Okay.
Because I know if you go for a physical is covered at 100%.
So nothing gets added to your.
Well, if they write a prescription, then you're gonna have to pay for that writing of the prescription. The physical is free, but the writing of the prescription, you're gonna have to pay for that.
But it still comes out.
But it comes out of your HRA. But once the HRA is exhausted, then funds are either gonna come out of your flexible spending account or they're gonna come out of your personal account.
So it's really just a risk.
But then, once you satisfy that $3,500, the plan pays it 100% for the remainder of that plan year.
I'm just thinking if I need
Which
to,
is
But if I
I do need
get
to
the
go get
80/20,
something looked at, and get an MRI, then it'll.
150.
Especially if you have the 1,800, because you yourself could
Yeah,
exhaust the
having
1,800.
Okay.
Yeah,
Times
by
12.
yourself.
Yeah,
Yeah.
but I'm paying $15 one time to go to the doctor.
So with the 80/20 plan, it is a PPO plan too. There are lower co-pays and co-insurance, for this plan, for this plan year 2017. Did you guys have a question?
Yeah, I've had the CDHP before at a previous company, so I was just talking about my experience from it.
Okay, how was your experience?
It's pretty good. I mean, it just depends on how healthy you are.
Exactly.
I mean, you know, if you're pretty healthy and the money carries over after a couple of years, you pretty much have your deductible met in case something happens. If you end up getting run over by a bus, then you can end up paying a little bit more out of pocket. But to me personally, all of it's just, what are the out-of-pocket maximums for the 3? What am I going to pay up front, and what's the risk of reaching that? And it's really kind of situation dependent. But
Okay.
But it is easy because, at least from my experience, I got a debit card associated with the HRA. So when I went to the doctor, I just handed them that debit card and they swiped it and it
Well,
came
for
out
this one, the only debit card you're gonna get is for pharmaceutical.
for pharmaceutical.
The other is just your Blue Cross Blue Shield card, same difference.
Yeah, okay.
Yeah, they utilize that.
But you can use your flexible spending.
Absolutely, but you have to exhaust the funds in the HRA first
That's
before you go to your flexible spending account.
So what's your
Oh,
out
how do you say for 2.5 years?
Because you're always
If
gonna
you're
give
out
your,
of network, then you can't use
Out
the
of pocket,
HRA.
for my deductible
For that,
met.
correct?
you can,
I
oh yeah, you
have
can,
mine.
but your
I
deductible's
have
gonna be
it left
higher.
over for a year or two.
Okay. And your out-of-pocket almost doubles
So
to reach the annual deductible and to reach the
So that's
I
out-of-pocket.
had a
your-
DC, it carried over a year. And in fact, I just did it a few years ago.
Calculation for your flexible.
Yes.
Because see, I use my
Say
flexible
you do the
for,
CDHP for a year.
to pay my co-pays
You
and
switch
stuff.
to the.
Yeah.
year after that.
So there are no co-pays
So
with the
we might-
CDHP.
Right, so if I
You
go
could
with
use
that, then I'm,
$50 for your copay. for the-
I won't need to.
Then you may
But the
not.
flexible spending account, I'm not sure if you guys know this, you can use your flexible spending account for eligible medical, you can use it for dental, you can use it for vision, you can use it for other people that are not on your plan. So my husband is not covered under my insurance, but I use it to pay for his co-pays, use it to pay for his dental care.
Really?
Yes.
I did not know that.
Oh, so learn something today. Yeah, so you can use that flexible spending account. I know where you're coming from. Like he said, he knows he's having having surgery, go ahead and max out that flexible spending account so that you can get the biggest bang for your buck. But you're right, you don't need as much for the flexible spending account.
But
I think I
if,
missed it last year.
what I'm saying is if you have to use your HRA before you're flexible, I mean, isn't that what you just said?
I did.
So
So,
you have to hit $900 before your FSA could even get that.
So you
Okay.
can't max out flexible because you have to use the HRA first.
I've maxed out mine. I maxed out my $1,200. I have $1,800 in my HRA. Right, exactly,
Yeah.
because I'm using my flexible spending account.
But what
for
do you
dental.
use for dental?
I can use it for dental, I can use it for my husband, I can use it for the kids' vision.
Buy some new glasses.
Yeah,
Well, that's what I do.
Right, I use mine
flexible, but I
for
don't-
vision primarily.
yeah.
So,
My
great,
glasses.
So there's more, just the flexible
Wisdom
spending
tooth
account doesn't have to
extraction.
always be used
That
for
wiped it out.
your medical. It can be used for other things too. For dental,
Yeah, but you're saying that. Okay, never mind. No, I get it, I got it.
Again, preventive services under the 80/20 plan are covered at 100%, as well as preventive medications. There's a list. And again, to reduce your monthly premium, you're gonna have to complete all three to get the biggest bang for your buck, all three wellness credits for the 80/20. Now, for the 70/30 plan, there's only one wellness credit, and it's just for $40, just for the smoking attestation.
Can you set up a monthly deduction into your HRA? So like, you get the $600, if I wanted to take $20 out of my paycheck and put it towards the HRA, can I do that?
That's a great question. The answer is no. That's a very good
Put it
question.
in your flex.
You cannot
You
put
have to put it
any
in flex.
money, right, you cannot put any money in your HRA, no earned income into your flexible spending account, into your HRA.
Can I ask another question? Sorry. Okay, so I get my $600 and I go to the doctor 3 times at $200 a pop.
Bam.
There's my $600. So
Exhausted.
then it's out of pocket for the next $900.
It is for your flexible spending account.
So when you said you had to use up HRA first, is that just the $600 you get?
So in your case, it is.
Right,
In
okay,
mine,
so it
would
wouldn't be, I don't have to meet that deductible before I can start using my flexible.
No,
Okay,
no, no, no.
okay.
You use your flexible in order to conquer that annual deductible.
Okay.
So does the money you spend on your flexible savings plan count towards your out-of-pocket too?
For your
Your
flexible.
max.
For
your
to meet your deductible.
To meet your deductible.
Yes,
Okay.
they don't care how you meet the annual deductible, it's just meeting the annual deductible.
And that can be, doesn't have to be healthcare. You were saying it could be dental vision.
No, but from your flexible spending account, you're only using the funds in the flexible spending account to meet the annual deductible for the HRA. Now, dental would not go towards your annual deductible for the
Okay.
CDHP plan.
Okay. Okay, so if I bought glasses on my flexible spending, it doesn't go towards that deductible?
Absolutely not. It only reduces your flexible spending
Right,
account.
okay.
That's a great question. I want to make sure we're on the same page. Okay? Everybody good?
Can I actually ask a question?
Sure.
They were asking about the HRA card, like the pharmacy card.
Yes.
Will they give
It's a
us a new
savings.
one
You
next
could
year?
take $15
Or will we
and
have
put
to
20
use the same?
I'm thinking we're gonna get a new one because our pharmacy is switching from Express Scripts and it's going over to the CVS Caremark.
Gotcha.
So everything will be new.
Gotcha.
Um,
And guys,
Yeah, I don't
there,
know.
the mics for this are on the
Send it to
table, so whenever we're live on YouTube right now, folks can hear a lot of background for us, so it's, so they can't really hear me as well.
Thank you, thank you. For the traditional 70/30, there's a higher copay. It went from 39 to 40. And then there's the co-insurance on the 80/20 went up as well. I mean, on the 70/30, I'm reading the last one, higher copays and co-insurance than the 80/20 plan. It says no incentives, but the last bullet says 0 premium for employee-only coverage granted you complete that smoker attestation. Okay? And please, I always say, don't let that premium be your determining factor for which plan you enroll in. You really need to look at the plans online. There's a summary booklet out there that says, if you're planning on getting elective surgery, or if you're planning on having a baby, or if you're planning on having knee replacement, this may be the better plan for you. okay? So that you can maximize, and there's nothing wrong with that. Also calling your pharmacy to see what prescription medications you've gotten in the last maybe 1 to 3 years. There are no benefit changes if you compare the in-network 2016 plan year with the 2017 in-network and out-of-network. You'll see that there's no difference there. And someone had asked about out-of-network. If you can see, it doubles your annual deductible as well as your co-insurance. Well, it doubles your out-of-pocket if you go out-of-network. Okay. As well as your maximum out-of-pocket. And then ACA preventive services such as physicals, they're covered at 100% in network, 65% out of network. So just think about that. And the BOB is the Blue Options Designated Specialist. There's a list out there that compiles all of the specialists, as well as hospitals that are Blue Options designated. I say that because once you visit these facilities or the specialists, then there's money put back into your HRA account. Okay, that's one way of earning money into your HRA. So these are the premiums, the new rates for 2017 for the Consumer Directed Health Plan, $0 for employees only. And you can see the rest, but this is in consideration of this person completing, these rates reflect completing all 3 wellness credits.
And those are annual numbers, right?
That's monthly. That's what you pay every month. And remember, we pay these 1 month in advance, so you'll see these new deductions come out in December because we pay 1 month in advance. They're effective in January. So this is a wonderful health engagement program for the CDHP. It's only available to CDHP members. One is the Healthy Lifestyles program that I was telling you about, how you can add money into your HRA. So if you speak with a life coach, they're going to add, if you do it at least 3 times during the plan year, you can get $25 into your account added. I've done it. The initial call took about 15 to 20 minutes. She asked questions about what do I want to do to change healthy, how do I want to get healthy? And it was just easy. And then I go online through Blue Connect and I can see where I've satisfied 1 of the 3 calls. I'm also tracking my exercise at least 30 minutes per day for a 46-day period. The period just started again in October. October 1st was the last of this quarter, for the quarter. And if you absolutely, I'm gonna have one person, and there may be some people online that are in the CHP. November 15th is the absolute latest day that you could join and do consecutively 46 days to get that additional $25 added to your HRA. The Positive Pursuits is another way to add money into your HRA. And this is for folks that have some serious health conditions such as COPD, congestive heart failure, diabetes, and high blood pressure. If you did things like follow your doctor's prescriptions, take labs, speak to a coach, you could also earn additional funds in your HRA. So the enhanced 80-20 plan is a comparison chart. We're looking at the first row, or actually the first column, gives you 2016 in-network. And then if you look at the 2017 in-network and out-of-network, you see that the annual deductible almost doubled for the 80-20 plan. And then the co-insurance is still 20% for in-network, but it's 40%. Like I said, it doubles for out-of-network for eligible medical expenses after your annual deductible has been met. And then for the ACA preventive services such as physicals, they're covered at 100%, but if you take it out of network, it depends on the services that are being provided as to how much of a discount it is, or if it's covered at all. Urgent care did go down a little bit, as you can see, with the 2017 plan year. And now these are the monthly premiums for 2017 for the enhanced 80/20 plan. Again, this is taking into consideration that all 3 wellness credits have been completed.
Where do you do those, the wellness credits?
So as soon as you log in to what I told you to go in through my PAC portal, the green icon,
Mhm.
once you complete the state health plan portion of it,
Mhm.
it's
The health
right
assessment.
underneath it. The assessments are right there,
All 3 of them?
all 3 of them. You must save it. In order for it to count, you must scroll down and save any work that you've done. My experience in helping employees enroll in their benefits is that there's a 20-minute time limit in order for you to complete that health assessment. It'll time you out, and then your benefits, your information that you put in will be lost. So you want to make sure that you, one, have your biometrics if you can, like your high blood pressure reading, and your sugar reading, if you have it available. If you don't, there is a radio button that says, I don't know. And you're able to select that. But just recall, it's only for the CDHP and 80/20 plan that you're gonna complete the health assessment. Speaking of the health assessment, if you complete the health assessment before October 15th, there's a drawing for 6 $250 Amazon gift cards that you're eligible to win. And then there's 1 grand prize winning drawing for an Apple Watch. So that's only if you complete your health assessment online. There's a number that you can call to complete it if you can't complete it online, but the only way to be entered for the drawing is if you complete it online. Please keep in mind that it takes about 5 to 7 days for that health assessment to generate that you've got the credit. So don't wait until the 12th hour or the 11th hour to complete your health assessment, because then you'll panic as to whether or not you've gotten that credit. So the traditional 70/30 plan comparison chart, as you can see, it went up a slight bit, the annual deductible for the 70/30 plan. And then the medical co-insurance max, it went up slightly. Then I spoke to you about the office visits and the specialist copay. These are the monthly premiums. And you see, only the smoking attestation is checked because that's the only one wellness credit that's applicable to the 70/30 plan that you'll have to complete in order to get for employee only $0. Complete your health assessment, like I said, by October 15th and have a chance to earn a prize. And you do this by clicking on your personal health portal through the state health plan. So now that we've gotten through with the state health plan, do I have any questions? Questions? None?
I do actually, I had one emails.
Okay.
So someone had asked, who do I contact to estimate the cost of medications? My son has an EpiPen or needs an EpiPen and he knows the cost of something like this.
So they'll need to get on to caremark.com and see how much it is. Because I know you guys have heard about the EpiPens. My daughter needs an EpiPen, and with the CDHP plan, I was paying something like, initially it was $800, and then they ran the numbers again, it came up to $650. And my son went to go pick it up, and he tells the pharmacist she's not that allergic, and he left the EpiPen. It was like $650. So I was like, wow, that's a lot of money. So the EpiPen seemed to be a little expensive. So she'll just need to, depending on the plan that she's on, or just look at the medications here through Caremark.
And I'm gonna repeat this question even though we've already covered it.
Okay.
It's, so if she's on the CDHP, can she put money in the FSA? So yes. Or should she put money in the HRA?
She can't. The only way you can put money in the HRA is to earn monies by doing certain incentives.
Right, but she can put it on the FSA for dental vision like we've already.
Absolutely.
And what was the percentage, once you meet your deductible under the,
CDHP.
yes,
After you've met that $1,500 deductible, your responsibilities for the co-insurance is 15% of all medical visits. You're
Okay.
responsible for 15%, and the plan will handle 85 of it.
okay, and it's 1585 if I were in a car wreck and I had already met my deductible and I've got to have surgery.
Right,
It's 85%.
15% you're responsible
Okay.
to get up to that $3,500 maximum out of pocket, and then everything else is handled at 100%.
Okay,
So let's talk about NC Flex now that everybody's okay with the state health plan, right?
Mhm.
So with the NC Flex updates for the dental, now with dental, we have United Concordia, for those of you who do have either the low or the high dental plan. We have MedLife, they'll be our new NC Flex dental vendor, and that is their website there. Enter your zip code and select a primary dental provider through their Plus network to find the list of participating in-network dentists. There's a new tier for employee and children, because before I think it was only employee plus one, or employee plus two, it broke it down. And it was like $70 per month. Now it's employee plus one child or four, and it's only $78 for that. The rates are decreasing, and be sure to inform your current dentist of this new vendor, because they're gonna try to, submit it through United Concordia when they're not the vendor anymore. Actually, MedLife is. Okay? So for the group term life insurance, which is the NC Flex group term life insurance, if your spouse are currently enrolled during annual enrollment period, you could add either 10, 20, or 30,000 additional coverage up to the guaranteed issue amount of 200,000. I think there's a glitch. It asks that you don't have to have the EOB, which is the insurance of evidence of insurability. It's going to ask you for it. So just go ahead and process through that, and they won't ask you no questions. If you're not currently enrolled during the annual enrollment period, which is over October 31st, you may purchase 20,000 of coverage on a guaranteed issue basis if you were not previously denied. And again, the rates are decreasing for the NC Flex group term life insurance. This is the mirror one that mirrors the MedLife group term life insurance. And at one point during this year, 2016, the coverage was less expensive through MedLife. So now they're saying the rates for NC Flex are now decreasing, so you may want to look at that. And just keep in mind, for those of you that are having birthdays that are milestones like 40, 45, 50, 55, like that, your rates will change after 5 years.
I hit one of those this year.
Did you see an increase in your?
I haven't looked yet.
Okay.
I'm certain I will.
Happy birthday.
Thanks.
On the NC Flex update on the voluntary AD&D, Voya is the new accidental death and dismemberment vendor, and this includes the core. Is everybody enrolled in core in this room? Please
That's the
take
free
that.
one, right?
That's the free one.
Yeah.
It's $10,000 of coverage. You must enroll in order to be covered. So make sure you have core AD&D versus you can still have the voluntary one, but the core one is $10,000 of coverage. You can't add or decrease the amount, and there's no premium for you. If you're currently enrolled in an odd increment, like 75,000, it's gonna bump you up to 100,000. If you're at 125, it's gonna bump you up to 150,000. So they want it in increments of 50,000, so just be watching out for that. There is no evidence of insurability required for the cancer plan. And this year, for the critical illness plan, you'll have 2 option coverage. Before, we only had the $15,000, and that was if you're in a critical illness, if you got cancer, or either have heart-related illness, or either organ failure, there will be a lump sum paid to you in the amount of $15,000. But now they have the $15,000 one and then the $25,000. Okay? If you want to re-elect or participate the first time in the flexible spending account, you must enroll between this time period. The deadline is October 31st. Remember, the minimum amount that you can put into the flexible spending account is $120 for both the healthcare and the dependent daycare. The maximum that you can put into the healthcare flexible spending account is $2,550, and then $5,000 for the daycare. Okay? As I mentioned before, it is a use it or lose it benefit. There's a grace period of 2.5 months that rolls over if you're participating this year. You'll have until March 15th of 2017 to utilize those funds. Now, you can still re-enroll this year to get more money stacked on top of that, but you'll have to utilize those funds from the first plan enrollment to go on to the next funds. And if you don't, then you forfeit those funds. Don't let that happen. There's a list of over-the-counter items that you can get if you need to go through that quickly. But remember, your healthcare flexible spending account can be used for dental cleanings. It can be used for vision, for eyeglasses. It can be used for someone else as long as it's an eligible medical expense. Okay? This is for the MedLife group term life insurance. Those enrolled in it already, you may increase or decrease your coverage. If you're increasing it, it's either $10,000, $20,000, or $30,000 increments with no statement of health if new coverage amount is less than 3 times your base salary. You may apply for MedLife for the first time with a statement of health and medical evaluation. So they're going to send someone out to your home and ask you a series of questions. Keep in mind that this is paper enrollment for this MedLife. The forms are on our website, but this is not done online. This is all paper. And it must be to our office by the 31st of October. With any changes or decrease or increase of amounts or either a cancellation or an initial enrollment. Now, those of you who've been working for more than a year or either 5 years, short-term disability, the North Carolina Disability Insurance Plan, you're already covered. These plans that I'm about to talk about are voluntary supplemental disability insurance. And this is the time to enroll in this if you'd like to. And for those of you on teasers, which is the Teachers and State Employees Retirement System, this is completely a voluntary long-term disability plan that's available to you. Okay? But you can only enroll in it during annual enrollment. Keep in mind, if you've had 1 year or more of participation in teasers, you're already covered through the employer-paid short-term disability. If you have 5 or more years, you're already covered through the employer-paid long-term disability. These are just supplemental. I have less than 5 years, so I do have this long-term disability just in case. So once I reach that 5-year mark, and many of you may want to think about this, the plan pays $66 and 2/3 of your base salary. But the NC DIP one pays $65. It pays 65%. So on this, it's just paying a 1 2/3% more. And this is paper enrollment as well. Now, for those of you on the optional retirement plan, which is the ORP, we have the standard long-term disability. Same is applicable. There is a 90-day waiting period. But with this plan, it protects the employee's retirement by providing a contribution equal to the money, the monthly employee and employer contributions, if you're on the ORP plan. And this also requires paper enrollment, but it must be received to our office no later than October 31st. This seems to be a very popular plan with some of the staff and faculty that have children that are of teenage age, driving age, for the representation in traffic court. It also provides free legal services for will preparation and estate planning and legal advice and document review. You also get a 25% discount on the other providers that are in a large network of attorneys.
If you have enrolled in this in the past,
Yes.
do you have to re-enroll?
No, it continues.
I tried to cancel it last year and it just didn't cancel. So I thought, well, okay, you know, I have
Maybe
it.
it's meant to be, just keep.
Right, but so I need to submit a paper form and cancel.
Yes.
Okay, I'll try that again.
Yes, and before October 31st. Again, cost is $9 per month, and enrollment is via a paper form. It's also via paper form to cancel. Again, no later than October 31st of this year, which happens to be on Monday. So guys, if you know the deadline is Monday, try not to wait till the weekend to do your benefits. You know, because if something can happen, it will. Just like folks that were, we had a storm this weekend. I lost power for a little bit and couldn't enroll in benefits. But had it been, closer to the deadline, I would have been in trouble. Okay, question. So let's just do a quick recap. The Hyatt Legal, the MetLife Life Insurance, Liberty Mutual, and Standard Disability plans are completed via paper form. You're not going to find this on the MyPac portal through MyPac portal. You can go on our HR website, and I think it was pulled up, and there's an option at the top that says forms. And you just click on the first letter of one of the, whatever you're wanting to enroll in, the forms are there for you. Enrollment for the state health plan, which is the SHP, and the NC Flex plans are completed online via the enrollment portal. Through MyPac portal for faculty and staff, the green icon that says enrollment benefits. There it is. Has anybody tried to enroll in benefits and had an issue where you didn't see the open enrollment and then your current benefits? Because I can send something to you. I'll send it to you, or you can send them to me, and I'll send them the step-by-step of what they need to do. It seems the cancer plan, and I think we discussed this, the cancer plan is holding a lot of folks up. I've had an employee say that I didn't enroll in the cancer plan. I said, I know, that's the problem. So that's what I'm asking each and everyone to do for 2017 or this enrollment period. Go through each individual benefit. And where it says enroll or decline, either enroll or decline. Don't skip over. Just go ahead and decline it if you're not going to participate. And it also acknowledges that you're declining that benefit for the plan year. Here's our website. And you can click here for annual enrollment instructions right beneath Mr. Wolf. In case you need any assistance, but if you need additional assistance, feel free to give me a call. Beat the flu, register for the flu shot. I think there's already been a flu shot clinic that's already started. So have any questions? Yes.
I have a specific one about CDHP. So Ginny asked the question about the 85-15
Yes.
split up until the maximum out of pocket.
Right?
Is your deductible go towards that maximum
It
out of
does.
pocket, even if the HRA pays 100% of that deductible because I've built up a balance?
Yes, absolutely.
Oh.
That's the way to go.
That is the way to go.
Yeah, because my $1,600 that's rolling over, coupled with the 18 that I'll get for the next plan year, that's over 30. That's $3,200. That'll satisfy 2 of my annual deductibles right off the bat, or satisfy at least one of my annual deductibles plus a maximum out of pocket.
Okay.
We were
Thank
pretty
you.
psyched to find out that, because we've been on it now for 2 years, as long as we've had it.
Yes.
And I don't have to pay anything for my birth this year.
How about that? I've heard nothing but good things from moms. I wanted to hear from moms, and I forgot to call you to ask of a mother that had been on the plan, given birth, not, added the baby to it afterwards, but had been on the plan and gave birth, and I've heard great things. I'm sure you're taking advantage of the stork
Yeah,
rewards.
store rewards and those incentives, because I have to go like every month or not twice
Right.
a month. Between that and then what's rolled over in the past, I actually am still gonna have a balance in my HRA after I give birth.
That's
For this year.
great.
That's what's
And
up.
I'm good.
That's great. So they're trying to, if you haven't noticed, they're trying to get a lot of people to the CDHP by all the incentives and monies that they give. But it's really, I think, a smart plan, especially if you are very well or if you're extremely sick. Because if you're sick, you're gonna reach that deductible quick, and then the plan pays for the remainder of the plan year. So just look at it and see what you think. And if you have any questions in the meantime, just give me a call or send me an email. Okay, no questions. Okay.
Thank you.
Thank you. Glad you guys came out. And I did bring my NC Flex book if anybody wanted to look at it quickly for the dental or explanation of anything. But the book is also online. I know a lot of people don't like electronic forms. I don't. I like to have the paper in my hand, so, but I brought the book just in case. Thank you. Okay. Sounds good.
Do you need any help?
Man, thank you so much for having me.
Yeah, we had up to about 40 people online.
That's good, because before, last year I did it exclusively to them, right?
Exactly,
So this is good, and we have
Yeah.
this all together.